Hi, everyone. Welcome to Smart Strategies for Aging Eyes, Coping with Vision Loss, presented by Subah, Gupta of Some Therapy. My name is Lindsay Reichert, and I am the Director of Wellness Initiatives here at Friends Life Care. We are so happy you are joining us today for an amazing presentation. Before we begin, I'd like to go over a few housekeeping items. On the bottom of your screen, you will notice a taskbar. On that bar, you will see the letters Q&A with two little bubbles. We encourage you to put any questions you may have in the Q&A box. Our presenter will answer some questions during and at the end of today's session. To the far right of your taskbar, on the bottom of your screen, you will see two little C's that will enable closed captioning. If you don't see that icon, click the three dots to the far right of your taskbar that says More. That should open up a number of options, including closed captioning. Feel free to turn it on if that would be helpful to you. Now, I would like to introduce Subah. She is a seasoned occupational therapist with over 28 years of comprehensive clinical experience across a diverse practice settings. She holds a Master's of Science in Occupational Therapy from the University of Indianapolis and a graduate certificate in low vision rehabilitation from the University of Alabama. Ms. Gupta is certified in sensory integration and brain injury rehabilitation, and she has earned the American Occupational Therapy Association Specialty for Low Vision. For the past 15 years, her focus of clinical work and education efforts have been serving pediatric and adult populations with visual disorders. Her approach integrates advanced clinical knowledge with empathetic, individualized care. She shares her expertise as a guest lecturer at local universities and regularly designs and delivers continuing education to professionals across multiple platforms. She is an active member of the American Occupational Therapy Association and founder of Some Therapy, a private practice based in Montgomery County, Pennsylvania, that provides specialized occupational therapy services for adults and children with low vision. So without further ado, I will turn it over to her and let her share all the wonderful things she has to say.
Hello. Thank you so much for the kind introduction, Lindsay. Thank you. And welcome, everybody. I appreciate you spending your afternoon here with me. We are talking about low vision today. And we are talking not only what low vision is, but more importantly, what can be done for low vision. And I would encourage you to go ahead and ask me questions, and I will answer those at the very end. The more the questions, the better it is. That's been my motto. So, our eyes, they are a wonderful thing. And that is because eyes allow us to understand space, right? Space is what is around us. Space is my understanding of where I am in relation to others. And others is not just people, others is also things, chair, table, window, door frame. So all of that is space. And it is because of the eyes we are able to understand where we are. And the eyes are the ones that are actually relaying this information to the back of the brain. So if the eyes are not working as good as they were, the information that is being sent to the back of the brain is not as accurate. And that is when we start to see some problems, which we will talk about here in a minute. Eyes also help us with speed. It is because of the eyes we can move fast, we can move efficiently, we can get things done in a timely fashion. And it is our eyes that help us adapt to dynamic environments. And with that, I mean is, I'm guessing all of you are sitting right now in front of a computer. So that is a static environment where you are not moving and things are not moving. But now think of yourself in a grocery store. Think of yourself at the airport, where it is not just you moving, but things and people also are. And things and people are moving in the same direction as you, or maybe in the opposite direction as you. So it is vision which is giving us the confidence, the flexibility, and the independence to actually work in these dynamic environments. Driving. Driving is big, where you are moving in a vehicle and there are so many vehicles that are moving around you, again at different speeds. And it is because of vision that we can do these things. We can be independent in environments that are not just familiar, like our home, but unfamiliar, new terrain, new environments. And the one thing that I see with most of my patients who've had vision loss, they are hesitant to go into unfamiliar, unknown places. Within their home, they have the confidence, they know where they are, they know where the things are, and they can manage. But you have them now move out of their home, and that is when you start to see the nervousness, the hesitancy. And that is because vision is helping us with those environments. Now, limited vision is occurring because of age. So, all of us will have a few things that are going to happen that are going to limit vision as we age. That is normal. That is normal aging. And then we have limited vision because of diseases, because of injury, because of trauma, or it could be because of all of the above. So there could be a combination of these factors. In normal aging, what do we see? What is normal and what is disease and what is injury? Normal is, and some of these terms may be very clinical, so I'm going to try and make it very simple. That first term is presbyopia. It's just a fancy word for needing glasses when we're turning 40, right? Our arms are just not long enough, and now suddenly I need to read, and oops, I need glasses. Usually happens right around that age of 40 to 50, or if you were wearing glasses for distance before, now you need bifocals, where you have that lower part of the lens that you're seeing through to read. Floaters, those are just protein strands in the eyes. I have them. A lot of members in my family have them. Again, it is actually relatively normal, doesn't have a whole lot of symptoms, other than sometimes you see those cobwebs when you're looking out into the sky or looking out into space. Dry eyes, a very benign condition. But if any of you have it, you know how bothersome it is. And dry eyes is where those glands in the eyes are just not working good enough. So you just have these poor quality of tears. You just have either the quality of the tears is poor or it is just insufficient. You just don't have enough tears, which is why when you are looking and working, the eyes just feel grainy. They feel coarse. They feel like there is sand in your eyes. And an easy way of taking care of dry eyes, believe it or not, is to blink, because blink is what stimulates that reflex, which helps in that production of tears. So if you are watching TV, if you are looking at your phone, if you're looking at your computer, what happens? We forget to blink. So one of the first things I do with my patients is I will write blink yay big. I'll laminate a piece of paper and I will stick it all over in their house because it just reminds them to blink to get those tears flowing. Pupils are smaller. As you get older, pupils go down in size, and that affects the amount of light that is coming in. So that is just something that we see with normal aging. And functionally, what we need now are glasses to read. So you're going to need either those plus lenses or those bifocals to read. There is this increased need for light. An 80-year-old needs 10 times more light than a 20-year-old. And light makes a huge difference, huge. As we get older, we are more glare sensitive. And maybe some of you have experienced this. Driving in dark is difficult because it is difficult to handle the glare that is coming from other light sources, whether it is the lamps on the side of the road, the street lights, or whether it is the lights of the other vehicles. Glare bothers the eyes a lot more as we get old. Reduced contrast. And this is something I see happening all the time. And I'll tell you what contrast means. Contrast is the ability to figure out an image as it is blending in with the background. So an example is you walk into the bathroom and there is a pool of water on the floor. Now, water takes the color of the floor underneath, right? But you can still make out that, yeah, I do see water. Oops, I need to be careful because I don't want to slip and fall. How are we able to do that? That is because of contrast. You can look at somebody, and by looking at their facial expressions, you can tell whether that person likes you or not. How are we able to do that? That nonverbal body language by just looking at those facial expressions. Because the color of the nose is no different than the cheek, which is no different than the chin, which is no different than the forehead, right? It is because of contrast that we are able to read those facial expressions. And as we get older, that contrast sensitivity decreases. Again, normal. Reduced dark light adaptation. How many of you have had difficulty walking into a movie hall and just needing to pause because your eyes need to adjust to light? And that happening again at the end, now when you're walking out from that dark movie hall into those lighted corridors. You need to pause, you need to give time for your eyes to adjust to that light. So this is all relatively normal. And then we have these diseases of the eye, which are actually age-related. And what I'm trying to do here is give you a picture of how it should be, which is to your left. And then there is a picture of how it would be. Oops, I'm sorry, I'm going to go back. And then there is a picture to your right as to how that image looks if you have that particular condition. So on the left is two boys, friends, laughing. And on the right are again two boys, friends, laughing. But what is happening on the right? There is less color, there is glare, there is reduced contrast, and that image is blurry. And that is because of the cataracts. So cataracts is where your lens is actually getting opaque. You're starting to have that lens that is not working as well. And what do we do for cataracts? It's a surgery, and you do get a new pair of lens, right? Easy peasy. Easy peasy in the vision world. So with cataracts, there is difficulty driving, there is difficulty reading, there is difficulty watching TV, just because of all those symptoms. But because of where medical science is today, cataracts is relatively easy to manage. There are a few other conditions where medical science is not where we hope it would be because we sometimes don't have the desired results. And one of them is macular degeneration. Macula is an area in the back of the eye, and it is because of the cells that are in the macula that we can appreciate color, we can appreciate form, we can appreciate detail. So when these cells start to die or wither away, we call that as macular degeneration. And the symptoms of macular degeneration are your central vision gets affected. So you have this black spot right in the center. Or in the beginning, you start to see things where it is distorted, wavy, blurred. You're not finding color and things are getting to be more and more black and white. When I first started 20 years ago, I remember my first patient and me picking up on this. And he walked in and he said to me, Subha, the grass looked blue today. And I was like, instead of green grass, now it is blue grass. And that has just stuck with me. So that is macular degeneration, where that color cells are now starting to be affected. And I know in the picture you see that black hole, but a patient doesn't experience a black hole. What they're actually experiencing is a blurred, distorted vision where everything looks misaligned. And they're just having this difficulty to focus. It does not result in blindness, thankfully. What it does affect in, and this is what is bothersome, is reading. Reading and recognizing faces are things that get affected. Now, why do we all read? We are reading to comprehend, extract information, and act on it, right? Even when we are doing pleasure reading, we are comprehending and understanding what we are reading. With macular degeneration, your reading gets affected. So I'm going to say a sentence. The strawberry is delicious. Now, with macular degeneration, you may not read the berry part of the strawberry. And when you're reading the sentence may sound like, the straw is delicious. Does not make sense, right? And if it doesn't make sense, it makes you reread and try and figure out what is happening. But there could also be times when you're reading it wrong and it may make perfect sense. Numbers, for example. My bill is $1,000 and I have missed the zero at the end because I have macular degeneration. So the sentence that says my bill is $1,000 can be read as my bill is $100. Makes perfect sense. But oops, that's a big difference between thousand and hundreds, right? So that is where macular degeneration comes into play. It is the reading and the facial recognition. The other condition is glaucoma. Glaucoma is where you just have this high pressure in the eyes. And if any one of you has glaucoma, I am expecting you're probably putting eye drops in to control and manage that pressure. My husband has it and I'm constantly on him. Did you put your eye drops in? Did you put your eye drops in? Because that's the only known cure other than surgery for now. In glaucoma, it's the actual opposite of macular degeneration. You're missing out on information on the side. And because you're missing out on information on the side, many times what happens is it gets missed at the very beginning because you really are not depending on the information on the side for your normal day-to-day activities. Glaucoma can lead to blindness. And because of glaucoma, what gets affected is mobility. Because if I am walking, I don't see that chair that is out on the side. I don't see the door frame. And boom, I trip over that chair leg that I didn't see. So you do have these falls and collisions. So if you have a family member that is having frequent falls, it may not just be strength and balance. Think of it also as, is there something happening with the eyes? Glaucoma can lead to disorientation. I'll give you an example. I have a patient who's in assisted living and she has to make her way from her room down to the lunchroom every day. And she knows her way because she knows there is this planter on the right and there is this picture frame. And when she sees that, she knows she has to take a right turn. Now you have glaucoma and you don't have your peripheral vision. You're going to miss that planter. You're going to miss that picture. And boom, you're going to miss that turn. And then she's standing trying to figure out where to go, which way to go. And that's that disorientation. And what does that do psychologically? It does shake your confidence a little bit. You start to question yourself. And that is exactly what we want to prevent. And we're going to talk about that. Diabetic retinopathy. That high sugar in the blood vessels, and the blood vessels are all over in our body, right? And because there are so many blood vessels in the eyes also, that high sugar in those blood vessels is going to actually disrupt or destroy those blood vessels. And what you start to see is this blood that is now starting to seep on that eye tissue that we call the retina. Depending upon where the vessels are involved, you kind of have this Swiss cheese vision, and that's that image to your right, where it is like looking through Swiss cheese. You have these islands of vision. So it is not center, it is not on the side, it's just kind of widespread. And with diabetic retinopathy, yes, you can have blindness if diabetes is not in check. Brain injury. There are a few patients that I have where it is none of the above, what we just talked about. It is had a stroke and now vision is involved. With brain injury, what we see most often is you have this one side of the vision that's gone. But the patient is not walking around with this black curtain. What is happening is the left field of your vision just goes all the way, but you're missing information on the right side. So you are accidentally bumping into furniture. The patient is only eating from half of the plate. They are always looking down just to know where they are going. They get startled easily because there is no peripheral vision. So if I may be there, but they may not see me there, and then suddenly they see me and they go, oh, because they were not expecting me there. Their peripheral vision is not there on that side. Numbers can be misread. 8 can be read as a 6 or a 3. And when numbers are misread, because you don't have the context of language, numbers you just don't want collections at your door because you misread a number and you didn't pay your bill you didn't pay the amount in your bill because you just didn't read the number right. So numbers do have a big significance. Banks, financial management, bills, this all does make a difference. And handwriting is going up and down. I have a patient right now, and the one thing she wants to do is handwrite a happy birthday card to her granddaughter. and she wants her writing to be straight. But what is happening is when she's writing, it's kind of just going uphill. So we are working on that. So what do individuals with low vision say? These are comments from some of my patients. They say, somebody just took Vaseline and smeared it over my eye. I really have to make sure I do not have eggshells within the mix. And this is a patient who's a professional chef. So because she has this vision loss, she really has to make sure that there are no eggshells in the mix. I am so careful in the kitchen. I do not want to hit my head on the open door of the cabinet. So if you have family members living with a patient with vision loss, what happens? The others don't really know that how you see. So they just go about moving things or not putting things back where they belong. Or you have these cabinets and doors that are open because they can see it, right? But you cannot with low vision. So what happens? You're bumping your head on that door that was left open unintentionally by a family member. Another comment, I always look down when walking. Another comment, I get confused in busy places, and that is where that social isolation is creeping in. If I get lost, you have to come find me because I cannot see faces. And this comment really drove the point home for me. So this particular patient loves to go to Center City, which is a crowded place, and she's always going with her friends. And she's told her friends that if I get lost, I cannot find where you guys are because I don't see faces. So you have to find me. So she's like, I'm going to scream or I'm going to shout, and then you come find me. So that's her way of dealing with her vision loss. I have ordered movies that I did not mean to because I pressed something on the remote just because I cannot see the remote. I have become like a first grader. I can't see and am nervous anywhere other than my house. Instead of seeing water boiling, I now hear water boiling. So that's where they are substituting vision. They're using their other senses to figure out what is happening around them. And overall, patients are afraid to leave home, and it leads to isolation and depression. There is hope. There is so much that we can do to help. I wouldn't say that there is so much that is out there these days. It is just a matter of knowing when and where to ask for help. And some of the things that can help. So I've tried to make it simple. I've tried to classify it into two. You have these low tech solutions and you have these high tech solutions. The low tech solution is first and foremost, add light. Light makes a world of difference. And when we are talking about light, it is not just getting another lamp and putting it in the corner. That will help. It will help because it is going to increase that ambient, that peripheral lighting that we need in the room. But what we really need to do is add task lighting. You need a table lamp or a light that is shining light on the table, on the sink in the bathroom, on that kitchen countertop where you're trying to cut white onions on a white cutting board. That is where we need light. We need light at the surface where you are working. So if you're reading, there needs to be more light on paper. If you're cooking, there needs to be more light on the stove. Not light in that corner of the kitchen. We're talking about light at that countertop, at that stove, in the fridge. There are so many times when I am just adding light in the fridge because you got to see what's in the fridge to eat, right? Where's the milk? Where's the cheese? Where are the peas? If there is no light in the fridge, how are you going to find those things? And then how are you going to cook? How are you going to feed yourself? Basic. And it is a particular lamp that we use, and then we try and match the light to the patient's eyes. Yes, I can increase the light, but what is the brightness of the light? What is the color of the light? Where should the light go? Well, it is a bright sunny day outside today, so what do I do with the light? Oh, it is gloomy like it is right now. Oh, what do I do with the light? So those are the things that we work on when you're choosing and adding a light. And even if you don't know these details, you cannot go wrong by just increasing the light. And one thing that I would recommend everyone to do who is having vision loss because of aging or because of a disease is just change the lumens. So it used to be wattage, now you talk about lumens. Just buy a bulb that has more lumens to it and get a table lamp. So if you're writing a check, make sure there is a table lamp there and it is that light under which you're writing your check. The second thing we do is manage glare. And it's not a bad idea to wear your shades indoors because what the shades do is they actually enhance contrast and they reduce the glare. I do match shades to the eyes, meaning the color of the shades to the eyes. But that is something that I do professionally. An easy fix at home if you're having glare is just to wear your shades indoors. Pull those curtains down, pull those blinds down. Look for some of these overlays, like that yellow color that you see on the paper. It is really giving that pop-up effect. And that is going to make it easy for you to read. Now, these overlays that we have, they come with all different colors. But putting a different color on a white piece of paper, one, the white reflects light. So that's glare. So when you put an overlay on, it really manages the glare and enhances that contrast. So these are some of the easy things you can do right at home. Modify the environment. Don't put milk in a clear glass. Put milk in a black, put coffee in a white cup because then you can see as the milk or the coffee, as you're pouring and it is rising, you can see the milk in the black cup and you can see the coffee in the white cup and you can prevent a spill. Or you can see it better so that when you're pouring it into the glass and not onto the table. So modify your environment. And I'm sure some of you have figured this out yourself because you're like, I can do this. Oh, this worked. Now I'm going to try and do this someplace else. So I have a patient and I walked in and she has a white placemat on her dark colored dining table. And that's how she knows that that's her place on the table. So she's already added contrast, modified her environment to help herself. So you want to use colors the best you can to your advantage. Magnifiers. I walk in and every time, kid you not, every time I will come across a drawer that has all these magnifiers that a patient has bought. They've just gone to CBS, they've just gone to Walgreens, and they just picked up one. And I walk in and they tell me, it doesn't work. And the reason many times for that is it's either not of the right power or they just don't know how to use it. or it is the right power and they know how to use it, but lo and behold, there is arthritis in the hand, there is tremors in the hand, and my patient is just not able to hold the magnifier because the hands are moving. So there are alternatives to that. And the alternatives to that get to be is you buy a magnifier that you can just rest on the table. It could be the right power, but buy one that you don't need to hold because either there are tremors, there is arthritis in the hands are not that strong, and it is difficult to hold it for a long period of time. And it is always helpful if the magnifier in itself has a light to it, because you want to give light every time, any time, doesn't matter. Light is going to help. So buy a magnifier that has a light because you want the illumination. Then are the high-tech solutions. Computers. I don't think we can live in this day and age without computers. And I do have a few clients who are still able to manage without computers, but then are dependent on their family to get things done. Because in this day and age, whether it is banks, whether it is talking to a friend, whether it is getting some information, whether it is accessing your health portal, most everything is done online. So with the high-tech solutions, there is a lot that we can do just with technology. One thing that I do from the get-go is I will try and make that background black. So you have that white font on black instead of the other way around. And we play a lot with font sizes, right? It is easy to read something that's this big as compared to something that's just this big. You want to go with laptops or monitors that have a wider monitor because you want, when you're going to make the font big, you are going to reduce that field. So you really want to go with monitors that are big. And then down below is an example of that high contrast keyboard, because we aren't just using our computers to read, we are also using our computers to write these days. So you need to be able to see the keyboard, and that is an example of a high contrast keyboard where the letters are in black and that background is yellow. So again, you have that pop-out effect. Electronic magnification. This is huge these days. So on the left is an example of a portable electronic magnifier. It is small, it can go in your purse, so it can go with you wherever you need it to go. And you press the button, it enlarges the print. So a client or a person is able to read it. It also gives you the option of different colors. So you press another button and then boom, instead of that white background, you may now have that yellow background. You may now have a blue background. And you press another button and it may even magnify it more because somebody may need less magnification, another person may need more magnification. So it has all these settings that we work with. And then on the right is like a CCTV, which is, it's big and huge and bulky. So it's not portable, but it does an awesome job of, you put the document under it, the camera reads it, it posts a picture of that document, but that picture is magnified or enlarged. And there is a dial, and you can change the magnification as you are reading. So I have a lot of patients that will actually have the CCTV next to the kitchen or next to the stove because they're just going to go ahead and put the recipe under. So as they're cooking, they're reading the recipe. Or I'll have patients who will use this to write. So you can see big as you're writing below and you can read what you're writing. So it comes in very handy for those skills. But there is so much that is out there that can be downloaded on the phone. Some of these are free, some of them have a subscription that you pay for monthly, and some of them just have this one time. You buy it this one time. So you can use your phone as a magnifier. You can have the phone take a picture of the document and then the phone reads it to you. You can have the phone take a picture of what is under it and it will tell you the color. You can have the phone take a picture of the room and it will tell you there is a chair to your right. There is going to be a table which is brown in color right in front of you. So it will give you the layout of the room. So when you are walking in, especially if it is a new, unfamiliar place, you know the lay of the land. You know exactly where things are, so you are not tripping and falling. Again, high-tech solutions, text-to-speech solutions. And these are the screen readers. The picture on the left is actually the picture of the ORCAM. It's a device that magnetically, I can't say that word today, it's that device that actually snaps onto the frame of your glasses. And again, it has these buttons and you give a command. So you speak to it and it will go back and kind of take a picture and speak back to you and tell you what the answer is. Comes in handy to read menus, comes in handy to read books, comes in handy to know what's in the room. And the picture to your right is the computer software. And this is what just came out a few weeks ago. It's called the Meta's Ray-Ban display. So again, it is a pair of glasses that you can put. So again, it can go over and it has these different commands and has this wristband. There is a lot of training that goes into using these devices. But if you know how to use it, yes, you can speak to it, and the computer software or the technology in these devices will give you the answer. So it is not that you are able to magically see things. That's not the case. But you can use technology to get the information that you need, which in the past you were using your eyes to do. So it is a good substitute. But I'm going to say this again. None of these are magic. All of these require training and practice before anybody is proficient in the use of these devices. And all of these are relatively expensive devices. So it is important to get a low vision exam done and not just go out and buy this thinking that this is just going to help you see. So here are some community resources. And we do have like the Bucks County Association for the Blind. We have the Chester County Association for the Blind. We have the Montgomery County Association for the Blind in our area. And then we do have the National Federation for the Blind and the American Foundation for the Blind. And that's globally. So here are some resources, and Thank you. Thank you so much for listening to me. I hope this was helpful, and I would take any questions if you have any.
I do have a few questions that came in. Some of them
Sure.
are from back when we were talking about diagnoses.
Mm-hmm.
So the first one is kind of a multiple question. So an individual had cataract surgery, and they are saying they developed an infestation of eye mites. Was this caused by the prescribed steroids? And then it
Mm-hmm.
said, is it common for this to happen? And then they went on to ask if they have not been able to procure the prescribed eye drops. Is it true that cleaning with tea tree oil effectively banishes eye mites, and is this safe to use?
I am going to ask you to call your physician to know the answer to that. Is it common? No. Can it happen? Absolutely, yes, it does. It can be a complication. Is tea tree oil safe in this condition? Well, we don't have any scientific basis yet to know if tea tree oil is or not. So the best thing to do is to call your physician and ask what the medicines should be and what are the other alternates to those eye drops, if any. I would not put tea tree oil without having that information from your prescribed physician. So it, and I wouldn't even call your primary care physician. I would actually call the surgeon or the eye care doctor that you're working with to get that answer. I'm sorry, I don't have the answer to that, but that is something that has to be a call by the physician.
Thank you. Another question that came in was, can you talk about the relative advantages of choosing distance versus mid-range, 8 to 10 feet, single range vision for cataracts?
So the advantage with intermediate is computers. This actually gets to be very personal. It depends a lot on what distance you are working at. If you're looking at mid-range, that is where we usually place our computers. It is beyond 14 to 16 inches. Now, single range, if you have those cataracts, single range may help you with the distant vision. So a lot depends upon functionally what do you need to use it for. I'm hoping that answers your question.
The next question was, I was surprised that you said macular degeneration does not lead to blindness. What does happen as it progresses?
Great question. Great question. And thank you for that question. So macular degeneration, only macular degeneration or macular degeneration in isolation does not lead to blindness because you have your peripheral vision intact. You're not able to see from the center, but you're not missing out on your peripheral vision because peripheral vision is the other part of the retina, not the macula, which is why it does not lead to blindness. But many times you can have macular degeneration with other eye conditions, and then, yes, you may have blindness. As macular degeneration progresses, you start to have that your lines. When you're looking at straight lines, the lines are not straight, they get to be wavy. You start to see this visual distortion. The picture is kind of wavy curved. You start to lose color in the visual scene that you're seeing. And as it progresses, there is that blur. So you're not 20/20 anymore. That visual acuity really goes down. And eventually, you do lose that central vision. Can that central vision loss be termed as blindness? In layman's term, yes, it does. And that is probably where that confusion comes up from. But with macular degeneration, you do not lose your peripheral vision. Hence, we say in the medical world that yes, it does not lead to blindness.
Thank you. A few more
Mhm.
questions. Um,
Yes,
Excellent coverage of many concerns. I'm probably going to say this wrong. Blepharospasm,
yes.
Blepharospasm, spasm, is
Uh-huh,
not
uh-huh.
common, but does affect many older adults, and this diagnosis is often missed. Can you explain a little bit
Yes.
more about this?
So that is where you are having the eyelids. And you're right, it is a very common condition and it is part of natural aging. And it is, again, a relatively benign condition, but a very functionally disabling condition because you have that spasm of the eye, which just causes that constriction. And then you are just waiting for the spasm to kind of die off and your eyes to relax and the lids to relax, and then for you to see back again. So, as you're having that spasm, you're just not having. How do we see? I'm going to go back. How do we see? We all see because light rays are entering the eye and then they focus on an area on the back of the eye. So anytime you have that spasm, you are just preventing or reducing the light rays that are entering the eye. So your visual acuity gets to be affected because your eyes are, so to speak, in a spasm at that. So that is what is happening. And yes, there are a few drops that can be used for that purpose, or you're just kind of waiting for it to pass, like muscle contraction, and you're waiting for it to relax, and then you can focus back again. So
Thank,
that is what that is.
thank you. Do you have any other strategies besides I would say, taking a break, um, and focusing back?
A big thing that we do is don't do near sustained tasks without breaks. So it is a preventative strategy. You're not taking a break after the spasm, you're taking a break not necessarily before the spasm, but you're taking scheduled breaks so you don't have the spasm in the first place. So that is what we are trying to do. It's a preventative strategy for not having the spasm. So it
Thank,
is like just scheduling your work accordingly.
thank you. One last comment that a member suggested is about adding light. There are
Mhm.
cordless LED lamps that can be very helpful if you need to add light in a place where you don't have access to an outlet, and they can be movable to different spaces when you need them on demand.
Absolutely. Absolutely. And they're very lightweight. So it's easy to just pick one and take one with you place to place. So, yes, a great comment and absolutely a great intervention. Thank you.
I
Thank you for that.
Thank you. I do have one question. Besides the Seeing AI, do you have
Mhm.
another app or two that you would recommend?
Are we talking about compensatory or we're talking about vision?
Compensatory.
Big magnify,
Big magnify?
magnify. Mhm. So big magnify would be one. Another one that I use to measure light is the Lux Light Meter app. And there are, I mean, if anybody's in construction or if anybody's in gardening, they may be familiar with this app. But instead of buying a light meter to test the light, it is just a good free alternative. And if you have that low light and you're looking at anywhere over 500 lux, so if you're using that app, that's the amount of light you want on the surface. But seeing AI and Big Magnify are the two good free resources that we have.
Great. Thank you.
Of course.
Um, I don't see any more other questions coming in. I will want to say thank you so much for your time today in this wonderful presentation. I think it gives a lot of information, both low and high tech options for our members to manage vision and stay within their homes. I did also want to make sure to share that Subah does have her own practice in the area and that you share your information.
You got me loose and set me free.